Hello, everyone. My name is Sree Sreenivasan. I'm Marshall Loeb, visiting professor of digital innovation at Stony Brook School of Journalism. Thanks for being here. This is an open chat. During this time when America is slowing down and shutting down because of COVID-19, I'm going to use technology to have conversations, to learn, to share. And today's guest is Dr. Lipi Roy. She is an MD who is a specialist in addiction medicine, but she's also made it her life's mission to talk to a broader audience about all kinds of medical and health issues. Please follow her at Lipi Roy, Lipiroy, and send me feedback at Sree on Twitter or email sree@sree.net, SREE at sree.net. Enjoy.
Just great to have you all with us. I hope you're all doing okay. You're welcome to jump in and speak if you'd like. But Dr. Roy, we have Dr. Roy for about half an hour, so I wanted to make sure we get as many of her thoughts in and any questions that we can answer, or she can answer, because I can't answer any questions. But it's a beautiful day, so maybe we just start there. How are you feeling? How are you doing? I'm so concerned about all my doctor friends and non-friends who are doctors and nurses and medical staff, frontline staff, administrators in hospitals. We saw the horrifying headline that the Italian minister or the doctor in charge of the coronavirus has died from the coronavirus today or yesterday. I'm just so appalled.
Yeah, well, Sree, thank you for just creating this opportunity for people to talk and to share their concerns. I think I share the concerns of a lot of people. And I got to be honest, if you asked me 3, 4 weeks ago, I would have said, oh, this will subside. I was even airing this towards, as a hysteria from media, from the public. But I got to tell you, I mean, the data doesn't lie. And if anything, it's probably underreporting because we just don't have enough tests out. So we don't know the exact number that are really out there. It's going to get worse before it gets better. And specifically, once we disseminate more tests. So by the way, for those who don't know, President Trump just declared a national emergency, which opens up a lot more funding in the billions to healthcare professionals, but also he announced like a private and public partnership, which is going to be absolutely necessary to ramp up the testing. And not just that, and this is the concern that I have along with a lot of my other medical and healthcare professional colleagues, is that once we test more, people are going to be diagnosed more, and that's going to place a massive burden on the U.S. healthcare system. And I really don't want us to go the same direction that that the people in Italy have gone, where patients, their doctors and nurses, are trying to decide who gets the ventilator, who's getting this kind of care, who's getting that, and we just don't want to do that. And so for those of you who've watched the press conference, Dr. Deborah Birx outlined an algorithm in terms of no symptoms, just stay isolated. But if you have symptoms, then there's testing, and then there's an algorithm, and information will come out. But I want people to know that if you do test positive, that doesn't mean that you should be running to a hospital or a clinic. I think the advice will be to then stay home to contain yourself and minimize your exposure to even more people. So there's a lot more information that's going to be coming out, but those are some key measures. But and I know it's easier said than done, but really stay as calm as possible and use good old common sense preventive measures. That's the biggest preventive measure right now is social distancing. It really, really is. I have canceled. I was supposed to see my tax accountant today. Cancel that. I've canceled a lot of things just so I can really focus on this issue.
Well, thank you. That's so helpful. And if you were, as you said, thinking that maybe some of this is a little overplayed, then you can just imagine people who are watching certain news channels where they're saying every day that this is fake or a hoax, or some of that even coming from the top of the the top of the administration here in the U.S. And then we're poisoned further by all kinds of online chats and people sending things to each other. And so this is a time of kind of great chaos. And we have more folks joining us from all over the place. My friend Patricia is here. My friend Bob is here. I really wanted this to be an opportunity for us to kind of just share, ask questions. There's a chat room. If you're on the computer and you're on Uber Conference, there's a chat room where you can go in and ask questions if you don't want to come on live. But if you'd like to come on live, we'd love to have you talk to Dr. Roy directly. But we want to just get as many questions in to Dr. Roy as possible. Part of all of this is my prepping for Social Media Weekend, where Dr. Roy was going to help and participate just next Saturday. And we are turning it into an online conference, and we're going to announce all the cool stuff we're doing. And Dr. Roy, who has been helping us with that, has just jumped in and very kindly helped me with this. Just a way to, I'm a kind of guy who loves to talk to people. So to be locked away from my students, my events, my lunches and dinners with friends is an issue for me, but of course nothing compared to everything else happening in the world. So let's see, anybody has a question, just let us know you'd like to ask one. Just come on and ask. Otherwise, I have several questions. And we also have Clara from Turin, from Torino in Italy. Clara, if you want to unmute your mic and want to speak, we'd love to hear from you. Otherwise, Dr. Roy, what are some of the mistakes people are making right now? And what is some of the things that are the biggest confusion? You told us social distancing is the best thing for us to do, but what are some of the other mistakes people are making?
Yeah. First of all, I would advise against going to the grocery store and going to like places and just hoarding toilet paper. I'm not still sure why people are doing that. I think they mentioned in the press conference, but there's nothing to indicate that toilet paper is going to be a protection whatsoever. So, and if anything, just from a public a common courtesy standpoint, I would just say, instead of going to the grocery store and going to stores and stocking up on stuff, maybe call up your 75-year-old neighbor and ask, hey, do you need some food? Do you need supplies? Just helping out your other fellow brother and sister. That's something that I would definitely recommend, just helping each other out. Because remember, we live in a community with other people. So let's help each other out as much as we can. So that's one thing. And this idea of like the more alcohol in terms of sanitizers, the better. That's actually not true. You just really need 60% alcohol. But you know what's even better than that? Just washing your hands with soap and water. I probably wash my hands 3-4 times. Again, I try to use sanitizer in small amounts when I'm outside, but even then, just good old-fashioned soap and water, washing really thoroughly, including under the nails, and 20 seconds. I mean, my surgeon colleagues already know this is what they do for a living, but for all of us, it's really important. And the other measure I would really recommend, I mean, I'm trying to look at this from a more global perspective, because this coronavirus epidemic, COVID-19, it's going to dissipate, it's going to go away. But let's use this as a lesson for just overall healthcare and prevention, which is something we don't do really that well as a country, which means let's get our flu vaccines. If you haven't already, please get it. We are actually in the midst still of flu season. And so, because remember, getting the flu shot, I know it's not 100% effective, but it still decreases your risk of getting the flu, which means it'll decrease your risk of going to the hospital and using up resources that really need to be devoted to people who are really going to get sick.
Well, thank you. That's a very helpful advice, and I think we should all be heeding it. Our friend Julia asked, would you recommend not leaving the house to go to the restaurants or gyms if you live in a city like New York?
Yeah, no, that's a great question. And I'll tell you what I just did. This morning, I went to the gym. The gym was very empty, but it was, but I mean, I don't think people should stop everything that they're doing. I think they should continue doing some things that especially something like being physically active, because that's going to boost your immune system and keep you healthier and increase your ability to fight off and stave off infection. So, and again, you also don't have to go to a gym to be active, right? I mean, you can just do jump ropes and skip and whatever and exercise easily in the comforts of your own home. Look on YouTube, look up cardio exercises and do like a quick 10 minutes at home or walk up and down stairs, but stay active so So to answer your question, I mean, yeah, I went to the gym, but I also sanitized, I washed my hands, and no one was near me when I was working out. So I was still kind of practicing social distancing. But yeah, I mean, but we have to go to the grocery store. I went to I bought groceries today. I went to Duane Reade. So I'm still going out and doing things, but I'm not going out as often. So I'm trying to be more mindful of how I can minimize my exposure to others, and yet do what I need to do to stay healthy.
Yeah, no, thank you. We have a question from Italy, where Clara, who's in Turin. Have you been, by the way, to Turin?
I haven't been to Turin, but I've been to Italy, more on the southern part, like so Rome,
Okay.
Venice,
Well, Turin
Florence.
is
I absolutely love Italy.
beautiful. Yeah, Turin is beautiful, and our hearts go out to everybody in Italy living in lockdown. So she says we have to maintain a safe uh, 1 meter or 3 feet distance from other people. Does this actually work? Should it be more than 3 feet?
Yeah, that's a great question. And by the way, I want to make sure that all of your viewers know that everything that I'm saying to you right now, Sree, I'm by no means an expert. I'm a certified licensed medical physician, but even I am deferring all of the advice that I'm giving now to the experts, the public health and medical experts at the WHO and CDC. These are men and women. These are epidemiologists and researchers who have literally devoted their careers to this. And so I'm following their advice. And so when they say social distancing, I believe the recommendations are like, I think exactly what Clara said, which is about like a meter or like 3 feet minimum. And if you can maintain further than that, that's even better.
One of the things I just read is that people are saying do the elbow bump as a way instead of shaking hands. I'm doing namaste as much as I can, but it
Yeah,
turns out the WHO has issued guidelines saying don't do the bump because you have to come within 3 feet to
right.
do the bump. So don't do the bump. So this is an example where we're getting information that is kind of half baked, right? We were told don't shake hands, so then we were encouraged to do other things, but it turns out
Yeah.
that may not be so good. Same thing with knocking your ankles together, right? Like that some people are doing as kind of an ankle dance. But again, here
Yeah.
that's going to bring you close. So
Yeah.
yeah,
I
folks.
wouldn't
Yeah,
quite call it half baked. What I would say is that our knowledge and advice is constantly evolving as we're getting more data. So yeah, even I was doing the elbow bump, but yeah, but I agree, especially as fellow Indians, I'm just used to let's really do the hardcore namaste, right?
yeah, exactly. Folks, if you're just joining us, I'm having a conversation. I'm here in uptown Manhattan and the Upper West Side. Dr. Roy is also in New York, and we are just having a conversation. We want this to be a group chat, so please jump in. If you have a question, just unmute your mic and say you'd like to ask a question, and we'll get right to you. Otherwise, there's a chat room on the side. There's also a way for us to test new technology. So we're trying Uber Conference right now, and I'm hoping to do kind of these half-hour chats every day until things change, because I need the contact even if others don't need it. But Dr. Roy is so kind to join us right now. So if you have a question, please jump in and ask. We have a question from the 804, maybe Richmond, Virginia. Somebody wanted to ask.
Oh, yes. Hi. Yeah, we were just put in touch with this group. We have a cousin that works at the UN, and she found this group. And I'm an anesthesiologist in Richmond. We are starting to see some patients that are and but I guess our hospital is being pretty vague about what we need to do other than wear the N95 masks and wear goggles and protective gear, gowns, that sort of thing. But these patients are just sort of showing up in our our operating rooms, and we're not finding out that they're being rolled out until like a minute before they show up. So I feel like the effort from our hospital in kind of coordinating this is not very coordinated, because ideally there would be a warning and that sort of thing. So I guess come up with a specific question about, we've talked to our chief medical officer, and he basically feels like we're being in a panic mode. But we just feel like we really need to spread awareness and how to protect ourselves and our staff. Do you have any suggestions for community hospitals in terms of organizing this effort?
Yeah.
Just before Dr. Roy answers, thank you, Doc, for calling in from Richmond, an anesthesiologist. It tells us that there is so much frontline staff who are doing things. You all are first responders, even if you're not out in the field like that. And we're so grateful to all of you for the work you do as in any part of the healthcare system. So I'm very grateful. I wanted to give you my email address, sree@sree.net, SREE@sree.net. If I could ever help you or we can be in touch, I'd welcome that. I don't want you to necessarily give your information on the call right now, but you can email me separately if you like. My name is Sree Sreenivasan, and I'm a professor of journalism at Stony Brook University, and I do a lot of things around tech and social, and so that's why we're doing these, and we'll try to do these every day, and we'd love to hear what's happening in Richmond and especially at your community hospital. Thank you so much. Over to Dr. Roy.
Yeah, so thank you to that. Yeah, and I'm sorry I didn't catch the name, but the doctor, the anesthesiologist in Richmond, Virginia. So I'm so grateful to these really, truly first-line healthcare workers and professionals, and in particular as an anesthesiologist. My extreme concern is going to be with the sickest people who are going to require ventilators and intubation, which this is like what bread and butter procedures for an anesthesiologist. So this is something that came up in the press conference where, I think people were asking in the reporters, hey, what's going to be the status of ventilators and PPE or personal protective equipment like gowns and masks? And initially there wasn't really a response, but then President Trump came at the very end saying, "Yeah, I'm gonna make sure there's funding for ventilators." So we'll see if that happens. But yeah, to your point about your specific hospital, I was just talking to one of my med school friends who unfortunately, has been exposed, and that was last night, and was just told today to not quite quarantine, but to be not come to work basically for 14 days, to be in isolation 14 days. But even at her hospital, again, it's mixed messages. They're not really being open about how there's been a patient, like a case. So I think I'm on faculty at NYU, and all of NYU Langone, they have been, I think, pretty aggressive in terms of their travel ban restrictions. They did multiple town halls. So I personally feel that the best advice right now, especially if you're a healthcare setting, an academic medical center, any type of clinical setting, try to be transparent. You don't want to be secretive. You want to be open with the public, with the people that are coming, or else your hospital is just going to get flooded with people. And that's actually the last thing that we want. And in fact, what's happening in Seattle, what I think you, Sree, already know, and your listeners might know, they've already had multiple cases. And I think the first case was there, and deaths. What they're doing is that they're doing kind of like they're building up tents outside the hospital, so that way people don't even have to come into the hospital. They're getting tested in the tents. And then again, in the press conference today, they're talking about drive-through testing. So like Walmart's going to open up part of their parking lots to set up these drive-through kind of testing, remote testing. So I actually think that's a great idea, and a great idea of like public and private partnerships. So.
Yeah, I think there's been a response. Oh, sorry. My name's Dr. Stein. Thank you for your advice and guidance. Our hospital, I guess, emergency room is setting up. That's sort of a triage, but I think we have a lot of patients that we don't have anybody that's diagnosed with COVID, but there are a lot of patients that might have it, and they may or may not have been tested. And the people that have been of course, we're asked to intubate these patients and also take care of them when they're having any type of procedure. But I guess we're not other than just trying to limit exposure and to protect ourselves, we're not really sure what to do if we may have been exposed to a patient with it. Like you said, that some people are walking around the hospital with masks and gloves on, but then they're going home and taking them off. So, do you have any recommendations if you were exposed to somebody that may have had it, that we don't know if they're going to come down
Yeah.
with it?
Again, I think the recommendation right now is that if you've been exposed to somebody, again, that's not that doesn't warrant testing. Testing right now is still only for people who are symptomatic. But for people who have a known exposure, the recommendation is isolation. And I think I'm not sure what the duration. I'll have to check on that again. Again, these things are changing, but it's going to be. I think it's 14 days. But again, and I want to make sure, because I know people are going to get really freaked out. They're going to want to be tested. It's really important to know that if you don't have symptoms and you get tested, it increases the risk for a lot of false positive testing. So we don't want that, because I believe it was either South Korea and Italy, but the testing of all the people who've been tested, only 4% test positive. So of all the people who've been tested who have symptoms, but that also tells you that that other 96% have other respiratory illnesses, right? So fever and cough and shortness of breath, I mean, 300 different things can cause any one of those symptoms, let alone the constellation. Coronavirus is going to cause very, very few of these, result in as the cause of these constellation of symptoms. So I think it's important for people to kind of recognize that and just take really good general overall care. And again, we have, unlike with the flu, we don't have really good rapid diagnostic testing for COVID-19. We don't have preventive measures like a vaccine, and we don't have treatment or a cure. Remember, for influenza, we had Tamiflu or oseltamivir. So I'm not saying anything to freak people out, but I want people to recognize that what we do know that works, that minimizes transmission, is social distancing and washing hands and other really simple conservative measures. So I want to make sure that's really clear.
Thank you. That is the doctor in Richmond. Sorry, I didn't get your last name. You were telling us your name.
Oh, Stein, S-T-E-I-N.
Schsein. Thank you so much.
Yes, thank you.
Thank you. And please, you have my email. If I can ever do anything for you, please do get in touch. We have about 5 more minutes with Dr. Roy. If anyone else has any questions, please jump in. Otherwise, I have a couple of quick ones. Dr. Roy, in terms of the outlook here, some people are saying the heat really makes a difference, and it's a beautiful day right now in New York. What is the latest thinking on the band of temperatures where this can grow or continue to thrive versus not thrive?
Yeah, that's a really good question. Again, I think my understanding is that it's really hard to kind of predict what the course of this virus is going to be seasonally. Again, for something like the flu or influenza, we have decades and decades of information. With the common cold, which is also in the same coronavirus family as COVID-19, again, we have decades of information on it in terms of its seasonality. So my short answer is that we just don't know. We don't know how temperature is going to play a role. Some people are predicting, come summer months, it's going to go away, but we have no data to support that. So it's literally going to be not even a week by week or a day by day, but almost like an hour by hour, seeing how this virus kind of plays out. And by the way, Sree, I've delayed my other appointment, so you've got me. If people want me for another 10-15 minutes.
Oh, thank you. Well, we all have you. We're so grateful. So we have several questions that have come in. Ideas, please, on the unavailability of hand sanitizer products. Thank you, hoarders. Can we easily make this stuff at home? Say hand wipes, things like that.
Yeah, that's a great question. And so the short answer is that I would recommend against making homemade sanitizers. Some people are saying, hey, I've got vodka, I've got gin and tonic. They actually recommend against using 100%. So this is an example where more is not better. Again, you just need 60%. And as I said before, so when I went to Dwayne Reed, they have signs up saying that they are limiting supply to like maybe 4 sanitizers or something like that, or for certain supplies. I think that's wise. We want to be able to share this with as many people as possible as sanitizer. But as I said before, like, yeah, I have sanitizer in my place. I mean, I'm a doctor, so I've got a lot of medical equipment in my place. But I really use soap and water. I really do. It doesn't, and make sure it's not hot scalding water. We don't want other burn injuries. Just warm water. The key is not that water or the soap individual. It's together, and it's the friction. That's what removes the germs, the viruses, the bacteria, all that. So that's what I'd really try to focus on.
Wait, can you say that again? It's the first time I'm hearing about this. So you're saying it's the friction that matters. It's not the soap itself, but it's the rubbing out of the germs in your hand. Is that right?
It's all of it together. Like, it's not just the soap by itself. It's not just water by itself, but it's really the idea of the friction. If you ever watch a surgeon, just go onto YouTube, watch surgeons and how they wash their hands under the water and they're getting under the nails. But it's really the friction action, that the rubbing that gets rid of the viruses, not just holding it under flowing water.
Okay, thank you. That's really helpful. Patricia asks, can you do a demo of the Namaste greeting and etiquette? Go ahead.
Well, we can both do that, Sree.
Yeah, exactly. So we can just do that.
Namaste. Yeah.
Yeah, for those of you who missed it, we just talked about how the WHO is saying don't do the elbow bump anymore. So if you need other ways to do this, we're recommending the Namaste. It works in both in our cultures in India, but of course here as well. And that's a pretty big deal. I just saw on Twitter, Doc, that one of the people standing behind the president coughed into his own hand, and then 10 seconds later shook the president's hand. So the president should immediately stop shaking hands. And I don't know why he's doing it. Vice President Trump was asked on TV today, should you stop shaking hands? And he said, no, I'm going to keep shaking hands. So talk about that, please.
Yeah. So, and then again, for those of you who watched the press conference, for several people. So I will say, I thought this was really cool. He actually invited many people up to talk about what their role is going to be in terms of this partnership. So we had people from CVS and Walgreens and Walmart, and obviously CMS and Dr. Fauci from NIAAA. So but after he had several of them, he then shook their hand at the podium. I'm like, oh my god. And then shook all these other people's hands. So okay, fine, but as long as right after that, rush and sanitize and wash your damn hands. So yeah, but and then remember, during the I think that the politicians or the Democratic candidates have been halting stuff, but when Biden was in Michigan, do you guys remember he was in the auto workers union, whatever, and he was like shaking hands with a lot of them? Again, I get it. These men, these hardworking men and women were waiting probably hours maybe to see the former vice president, and I get it. I'm quite certain he has staff around that are sanitizing his hands right away. So, but yeah, it's tough. It's so human, right, to do that.
No, thank you. That's great advice and great observations. Folks, if you're just joining us, we're having an informal, impromptu conversation with Dr. Lipi Roy, who is a physician in New York, who is an expert on addiction medicine. And I bet she thought that was the thing that would keep her busy, considering we have that crisis still going on in the country. But she's also a specialist in kind of talking about health and medical issues. She's been on every major program, including Dr. Oz. And so we're really grateful to have you. She writes a lot on Forbes. You can find her on her website, lipiroymd.com, LIPIROYMD. So do check her out. And she's also on Instagram at Lipi Roy and Twitter at Lipi Roy. We all need a doctor friend who can communicate well, and you all now have one. So please do follow her. I'm going to come to you with a couple of other questions. Someone here says, I'm here because I feel a bit paralyzed at this time. I'm a professor, and next week is spring break, and then we have 2 weeks of online teaching. So what do you tell people who are in fact feeling kind of stuck at the moment? She says, I was inspired by all the things you said you would be working on at this time. How do we stay motivated when things seem so uncertain and the news is so pervasive? So I'd love your thoughts, and then I have some as well. And let's crowdsource some answers from everybody else. I can see from my Uber conference that some of my most productive friends are online at the moment with us, so we can hear their thoughts as well. Doc, over to you.
Yeah, so thanks for making that invitation really more global, Sree, because I really do want to hear from other people, other ideas, innovative, creative ideas and suggestions. And especially, remember, this is going to be, this really has to be an all hands on deck, a community global approach, or else this just, we're never going to be able to get over this. So yeah, to Ms. Kelly's point there, Professor, yeah, initially when talking to my colleagues, we didn't think it was necessarily wise for schools to shut down. That would mean kids, where would they be? They'd be with adults, and many kids are taken care of by their grandparents. So that means exposure to older people. And remember, kids, at least for now, they don't seem to be vulnerable to this virus. But at this point, I mean, it's making sense now to, given the rapidity of the spread of this virus. So yeah, this is going to pose a lot of logistical challenges for a lot of people, families, communities. It's going to be a real issue. But I also want to add this idea about motivation and just a positive attitude and just being calm. I am, before I entered the field of addiction medicine, I was a general internal medicine primary care doctor for years. But prior to that, I evacuated from Hurricane Katrina as a second-year medical student at Tulane. And I've been talking to a lot of my med school classmates, and we're like, we could not think of another time when we felt this type of like national anxiety, except when we were in the midst of Hurricane Katrina. We were just so directly affected by it as students who evacuated from Louisiana, because it was unprecedented for a U.S. medical school to shut down. And we had no idea what was going to happen. We had professors, faculty driving sometimes from New Orleans to Houston, where we were temporarily relocated. But and I understand that was a hurricane, natural disaster, different from this virus, but there's some common threads. And one of them, several of them, one of them is really just staying calm, not overreacting, not stalking your homes for the next 6 months, just really taking this maybe a few days at a time. A, B, listening to people who've kind of been doing this, who devote their careers to this, whether it was military back during New Orleans and with FEMA, but really listening to healthcare professionals, public health professionals and epidemiologists, and just looking at the data and using common sense preventive health measures. That's really going to be key.
Thank you. Those are great observations. And folks, if you have questions, please post them. There's a good chance to hear from Dr. Roy. Let's also explain for some of the folks who haven't probably paid attention earlier, coronavirus is actually the name of a certain kind of virus that always exists. This particular strain is called COVID-19, and that's technically the better name. Is that correct?
Yeah, thanks for clarifying semantics there, Sree. So, right. So when you think of viruses, right, viruses are actually subdivided by families. So there's flavivirus, there's adenovirus, rhinovirus, norovirus from those cruise ships. And then this current what we're dealing with, the coronavirus family. So the common cold is a member of the coronavirus family. But I'm not sure who made the designation of COVID-19. That might have been the CDC or maybe NIH. But COVID-19, 19 because of 2019, but COVID-19 refers to this specific viral strain that's kind of wreaking havoc. So yeah.
I missed the news that President Trump says he will likely get tested after so many people around him have gotten sick. So I'm glad that he's going to get a test, and that'll be a good modeling behavior, right? We say that sometimes. By the way, also while all of this has gone on, Bill Gates is stepping down from the Berkshire Hathaway and Microsoft boards. He's obviously not been CEO for many years, but these are all like big headlines that are now getting lost in all this news. So are you paying attention to the news, Dr. Roy, every second, or do you have to because of your work?
Yeah, I mean, I'm paying attention because it's fascinating. I'm as a medical and public health advocate. This is my life's mission and my agenda in life. And I just my mission is just to really disseminate accurate and evidence-based information to educate and empower the public to make healthy decisions. That is my mission, my sole mission in life. So, but to answer your question, Sree, yeah, I mean, I'm trying to watch the news and listen to the radio, but every topic seems to be consumed by coronavirus. But no, the world goes on, and the world will continue to go on. And remember, there's a lot of other health issues that impact all of us. And there's a lot of other social and other social justice, criminal justice, gender, and lots of other issues that are going on. Like the world goes on, so we need to find that right balance.
And that's hard. Patricia says, what about those disposable face masks that you can use when you're in the gym or walking about? I know they're said to not be useful, but at least they're doing something.
Yeah. So the recommendation for those masks, first of all, is do not wear it unless you're sick. So if you have symptoms, then wear it. But if you don't have symptoms and you're wearing that mask, some say that can actually be worse because you could be containing. I'm not really sure what the mechanism is, but I do know that it's very clear that the recommendation is to not wear those kind of paper, whatever masks are, unless you're sick, to minimize your exposure of whatever illness you have to others. But yeah, Patricia's right in that in the hospital, it's not those masks. They're wearing N95 masks, which are designed for an individual's facial structure. I've been fitted for N95 several times in different hospitals. And those are effective against respiratory droplets from tuberculosis and other airborne infections, not just viruses, but bacteria.
One of the things I heard on TV is why you shouldn't use them is because they're also meant to be disposable. And so by wearing it, and then you're futzing with your nose and touching it, so you're more likely to inject things onto your own face and get sick by using it than not.
Right.
So let me go through a list of things just for people who joined us late. Restaurant meal this weekend, yes or no?
Are you asking me, Sree?
Yes.
So look, I'll tell you, I had dinner plans later on tonight. I actually canceled those. Again, not because, and I had very, very mixed feelings about that. And again, that's actually a personal thing that I did, not necessarily medical advice. But I also canceled my dinner plans with somebody who happens to live up in Westchester. So even though this person's not symptomatic, again, it's what I'm trying to do to minimize potential exposure. Because the other thing to remember, and Dr. Fauci has mentioned this several times, even if you're feeling well does not mean that you aren't harboring the virus. So you can still be shedding virus, but either both before you're sick and after your symptoms have gone away. I can't remember the exact number of days. So again, and it's hard for us to think like that, oh, I might have a virus, even though, and shedding that virus, even though I feel well. So to answer your question, Sree, I want people to really use their judgment. Life does go on. I think it's okay to go out and have a meal. I would just avoid big crowds and most certainly avoid going out if you're feeling sick.
Would you go get your hair cut, for example? Would you feel better if the barber or the stylist was wearing a mask so that they're not breathing on you, or should we just wait to get our haircuts? Not that I have a lot of hair to cut.
I think it's okay to get your haircut. I think it's okay to go to the grocery store and do that. I guess the United States can't really do what I think they've done in China and what they're doing in Italy now in terms of like really mandating quarantines and self-isolation. We can't really do that, or at least we're not at a stage where that needs to happen, needs to be mandated. And I think that's legit. I think that's warranted. But yeah, no, go get your hair cut, wash your hair, buy groceries, go to CVS. But as I said before, just practice preventive measures and precautions. If you're sick, wear a mask, or actually if you're sick, don't go out at all. Get somebody else to do it for you. So yeah, and wash your hands.
All right, we have just a few minutes left. I want to share what Clara wrote from Turin. She said, I could share this. The situation is surreal. We're locked down at home. I'm the only one going to the supermarket and pharmacy. Everything else is shut. This is to follow the government request to have only one person per family going out in order to limit the number of people in the streets and possible sources of infection. Schools have been closed for 3 weeks. Museums were able to open for a couple of days. But if you go out, you will probably have to wait in line as they're limiting the number of people entering these establishments. Technically, we're allowed to go out and practice sports alone, but the parks have become overcrowded. There are no masks, alcohol, antibacterial gel, and other cleaning products with antibacterial properties available. I was finally allowed to work from home today, so I don't have to travel every day. Hopefully this will work and they'll be able to contain the virus. Just think about that. They were actually able to say to people, no economic activity except pharmacies, supermarkets. It's not the American way, right?
Not at all, actually. But
you're Canadian. We should say you're Canadian.
Right. Yeah, I got my Toronto shirt. Woohoo. Yeah, no, exactly. But if we don't get our act together now, we are headed in that direction. We really are. Because now we have endogenous cases of coronavirus in this country. So it's not just from travel. We have person-to-person transmission now. So we got to really be careful, or else it's going to be a massive outbreak in this country. We're already seeing rapid cases already. So.
Wow, that's scary, folks. We have a few more minutes. If you have questions for the doctor or comments, please let us know. Robert, sorry, hi, go ahead. Who's this?
Hi, it's Stefan.
Hi, Stefan Kaplan's our friend, and he's on Twitter at Spinit Social, SPINIT Social, and Instagram as well. Go ahead, Stefan.
You're calling your lab. There's somebody trying to cut in.
So I have a what is that? I have a question, because one of the things that concerns me the most is, so let's say, example up here in Ramsey, New Jersey, they just closed the schools for 2 weeks, and the libraries are closing for 2 weeks, and everything up here seems to be closing for 2 weeks, because I understand that the 2-week incubation period is the period that they want to have everybody stay away from all the groups, stay away from school, stay away from the library. And then, therefore, if somebody gets sick, they'll know within 2 weeks if they start to exhibit or exude the symptoms, for example, after the 2-week period. And then they'll know better than to go to school and everything else. But my question is that if then somebody else comes about that's sick all of a sudden after that 2-week period, it's going to start all over again, isn't it?
Yeah, so I do think it's reasonable to just kind of shut things down, just slow things down for 14 days. Yeah, it's going to be disruptive for people. It's going to be a real change for a lot of people, but I think it's reasonable, more than reasonable.
Oh no, I think it's reasonable. I think it's reasonable, but what concerns me the most.
It's yeah, it's hard to answer. I mean, because yeah, I'm almost certain that this is not some magical cure that in cases will pop up. But I think it will, because we've already seen. So that's an example of social distancing. We already saw that in China once they took really pretty severe measures. I think the number of cases have plateaued since implementing those measures. But yeah, I'm quite certain that cases are going to probably pop up even after that, and but hopefully that'll buy us time and for healthcare systems to really stock up and be in a place where they're better prepared should there be a lot more cases.
A quick follow-up, Lipi. I know you can't nail this because you can't say when. Nobody can say when. But given your experience in the medical field, I mean, what do you really honestly think is going to be the time period between now and whenever that they come up with after having to test it and everything else, where they'll have a vaccine?
Yeah, that's the kind of question where, Dr. Fauci was asked too, and what he said was, because he predicted this, right, this peak and it coming back down, and what he's really trying to do, and with all of these measures, this public and private partnership, is to blunt that curve. So instead of going like that, it's kind of just like that. So, but and he was also asked about timeline. Just no way to predict. We just don't know. And
But
that's
it
why
takes
we've
months, right? Even if you had, would it be, sorry, Lipi, would it be fair to say that if I were a pharmaceutical company, I have, a sense of this might be the version that could work. There's a whole trial period, and then getting it out there, and then manufacture, right? It's not like you just, it has to be made and then distributed and all of that, and which countries get it first. All of this would be
100%. Absolutely. These things take I mean, this is unprecedented for, I think Trump said in the conference that they, with Roche and Becton Dickinson and these other manufacturers, they're going to have like 1.4 million test kits by next week, and then 5 million by the end of the month, which, by the way, he said, I'm sure we're not going to need that, but he has no way of knowing that. So, but it's almost unprecedented for this much, like this kind of manufacturing upscale. It's unheard of.
Yeah.
Thank you, Lipi. Thank you.
Thank you, Lipi. Folks, we have Dr. Roy for a few more minutes, and we're going to do this every day. I'm going to do this at least half an hour. Maybe Dr. Roy, others will join. We can talk about other aspects of this, because not just a medical story, it's a societal story. We're living in a time when Broadway is closed, when sports are closed. Even the Tonight Show and Jimmy Fallon, shows like that, are, first we're saying not taping with audiences, but now they're not taping at all. So these are things that we would have turned to for kind of a break from these terrible news items, and for weeks or months we could go without them. So that's kind of there's so many aspects of this that I'd like to talk about with my friends and others. Let's get some more voices in here. Bob Anthony says, not a medical question, but I think the makers of Amazon Echo, Facebook Portal, Google Nest are missing an opportunity to make these video call devices compatible with each other. Right now, they're using old walled garden approaches where the devices can only video call devices made by the same company. Just seeing colleagues and friends can be calming right now. I totally agree, Bob. And I'm seeing only your avatar on Uber conference, your emoji. I would love to see you and say hi to you, as I would to everybody else. And what he's talking about specifically are the video units, and there's many of those, and they're kind of spread out. And America made this mistake before, folks. If you go back in history, and Bob Anthony, who's a fabulous expert on technology, will tell you, the rest of the world was doing texting and SMS and all these things long before America, because they had open systems, or one system for all their cell phone carriers. In America, we let 1,000 flowers bloom. So if the earliest days of texting, if I got Dr. Lipi's number, I couldn't just text her. I'd also have to ask her what her carrier was. Can you imagine that scene? Whereas in the rest of the world, they said, we're going to be on this one standard. And then so everybody was on the same, basic system, versus today when it's in this. So that's what's happening, and we're repeating that history here. Julia says, what do you think about Biden doing a virtual town hall regarding the coronavirus? Is that a good idea? I know CNN has been doing fabulous. They've done 2 of them already, global town halls. What do you think about the political? I know you're not a politician or an expert on politics, but what do you think about that?
No, well, I'm sure Sree, you can comment on this as well, for you personally and professionally. But for me, I had multiple events, trainings in Boston, a conference in Miami, a health conference, and massive upcoming medical conferences, all canceled. The ACP, which is probably the largest American College of Physicians conference, canceled. ASAM, which is the American Society of Addiction Medicine conference in April, canceled. So in lieu of that, a lot of them, I'm not sure about the big scale conferences, but the smaller ones are doing a lot of video conferencing, Zoom. Let's utilize technology and still stay connected. But I do want to bring up a point, though, Sree, that you brought up, especially for New Yorkers. I didn't think anything stopped New Yorkers. You still see them walking around. But isn't that one of our biggest source of revenue, our tourism, right? Museums and Broadway and sports. Again, Toronto, go Leafs, go. my Leafs are going to play tomorrow night against the Boston Bruins. I was so looking forward to it, but the NHL, like the NBA, has just paused all games. And so, look, I'm a doctor, but I'm also a fan. I'm a fan of Broadway. I'm a fan of sports. But I recognize that public health and safety just has to take precedence right now. These are all temporary measures. But I don't want people to just be all depressed and alone and isolated. We have other forms of connection. I get sure you're an expert on this, but I mean, we can pick up a phone, we can text, we can FaceTime, Skype, we can meditate, we can cook, we can bake, we can watch TV, watch films, catch up on reading. There's a lot of other things that we do. Think of this as a time for self-care. Really, it's almost like a mandated, but think of this as the time off that you need. Think about when you get really sick and you're like, oh my God, this is the worst time for me to get sick. But that's sometimes Mother Nature's way of telling us to just slow down. So maybe that's another way to look at things.
Yeah, I love that point. Thank you so much. I know you need to go, so we'll let you go, or you could step out anytime. But before you go, I'd love to hear, what are those degrees behind you? You've got a nice degree wall behind you. Just read it so we know what you have.
I'm setting up my home office, so
Yeah.
so that I look a little professional, Yeah, maybe let me see if I can put my laptop up to it. You can take a better look, but yeah, I think that's my McMaster undergraduate degree, and then that's my addiction medicine degree or diploma. That's Duke University, where I did my internal medicine residency, and then what's up there? I think that's med school, Tulane, and I think that's my MPH. And then, down here, Commonwealth of Massachusetts gave me something. And, this is U of T, my other master's degree. Yeah, it's a lot of letters, Sree, but you know me. I'm just a big goofball at the end of the day. So there you go.
Well, thank you. And you're just so kind to share your energy and knowledge with us. And I hope we can do this again in the next few days, because every day people have questions, and there's a lot of good information on TV, but having this kind of connection is really special. So I appreciate that very much. Thank you, Doctor. Anytime you need to leave. Namaste. And Patricia says big thanks. And I know everybody who's listening to this, we also recorded it so that the audio can be played and people can catch up later. So I'm just so grateful to you, Doc, for being with us. And everybody who's watching, I'd love to do this every day for about half an hour, just talk, look an hour past. So if you have any comments or questions or on how we can do more of this, Sree at Sree.net, SREE at SREE.net, at Sree on Twitter, SreenEt on Instagram. Dr. Roy is Lipi Roy on Twitter, on Instagram, and Dr. Lipi Roy .com on her website to see all her stuff. She also posted her Forbes stories, which is great. And I know you're going to be out on TV this weekend, so we're very excited to see you. Let us know when you're doing that. Kelly says thanks. Clara says thanks from Italy. Our hearts go out to all our friends in Italy and China and South Korea, all these places affected. And now we're starting to see that here. I'd also say, Doc, that watching Governor Cuomo was kind of very calming for me today, which is a big step, and shows you that you can have government leaders that can make you feel good. Oh, Dr. Roy is going to be tomorrow on MSNBC, 2 to 4 p.m. to discuss COVID-19. So are you there for the whole block, or they just said somewhere between that?
They just told me to be ready, so I'm going to be ready. Who knows? I could be on for 5 minutes. I could be on for 2 hours. I have no idea. So,
where is it? Are you going in somewhere? You're going to do it from your home office? What's the plan?
No, I'm going to go. I think their studios are at 30 Rock, so that's where I'll be. So stay tuned. I'm just honored to be able to talk about whatever I can, especially to reassure the public as best I can.
Thank you. And you've done that today with just this show. So thanks, everybody, for listening. If you want to jump in and say anything, there's a good chance. Very easy to just unmute the mic. And also, if you have any feedback on this format versus doing Zoom and other things, I just love how easy this is, and it's more audio than video, which is really important. Not everybody wants to talk about these things on camera. And so jump in, give me feedback, Sree at Sree.net. Connect with me on Facebook, LinkedIn, et cetera, et cetera, et cetera, et cetera. All right. Thanks, everybody. It's been a fabulous hour for me, and so grateful to everybody. Thank you, and be safe out there. And Stefan, thank you for participating. Says thank you again, Lippy and Sree, and be safe, everybody. Thinking of everyone with elderly parents. The only good thing that I can think about this is, knock wood, so far the kids have not been affected. Normally they always say very young and very old. Somehow, for reasons I don't think are quite clear to everybody, the young are not getting sick in the rate that they do with flu and other things. So let's be grateful for that.
Elderly and chronic illnesses.
Yeah, of
are
course,
more
chronic
vulnerable.
illness of any age. Sorry, that's true. But the young kids, who are typically susceptible for any of these diseases, have somehow been spared, and thank God for that.
It's been a surprising blessing, but yeah, I'll take it for what it is for now.
Yeah. Thank you, Dr. Roy. Thank you, everybody. Please keep in touch. Anybody who wants to chat, just pick up the phone, call me, text me. I'm here. I miss so many of my friends, and this is giving me a chance to connect with all of you. We'll say goodbye. See you again.
Bye, everyone. Bye, Sree.
Bye.